Good morning, Mr. Carl. How are you doing today?
I'm doing well.
Good. My name's Cassie. I'm a student physical therapist assistant, and I'll be working with you today. So I looked at your chart. I know you have spinal stenosis of your L3 and L4 spine with some radicular pain going down your leg. So the stenosis is just basically the narrowing of the spinal canal. So we're getting some compression on the nerve roots, and it's impinging and compressing them and causing some pain down the leg, okay? So what we're gonna be working on today is some flexion exercises. So flexion moving means moving forward like this to kind of help open up that space and hopefully reduce your symptoms of pain. Some things we want to avoid is the opposite motion. So we want to avoid extension, going this way. So once we start doing our exercises, we're gonna have you laying on your back because that will put you into a more flexion biased position and kind of encourage that spine to move forward and open up for you, okay? Okay, so just to kind of get an idea, how would you rate your pain right now, 0 to 10?
I would say it'd be about a 7.
A 7, okay, so some pain today. If those symptoms start getting any worse, the pain gets worse, or you feel like that radicular pain is going more towards your toes, that's not what we want. So please just let me know and we'll stop our treatment and figure something else out, okay? All right, so we're just gonna be on our table today. So I'm not gonna put a gait belt on you because we won't be up and moving at all. Later on we can probably put it on, so we'll do more standing activities. But today, I'm just gonna have you come on the table for me. So go ahead and lay down on the plinth right here that we have. Okay. All right. So I'm gonna come over here. All right. And then a few of these exercises, I'm just gonna be placing my hand underneath your low back just to make sure that we're contracting the right muscles and doing the right motions. Is that okay?
Mm-hmm.
Okay, great. So the first thing we're gonna work on is called the posterior pelvic tilt. So we're trying to get that pelvis kind of moving down to the table, moving us to more of a flexion position to help with a little bit of stretching of the posterior sides, like the ligaments and the muscles on the back side, and a little bit of more segmental mobility, okay? So if I can go ahead and put my hand behind your low back, all right, you can keep these knees bent. And what I want you to do is I want you to push your low back down into my hand, just kind of like you're trying to squish it. Good, that feels great. Does that feel okay?
Mm-hmm.
All right, so now our goal for this one is we want to hold it in that position. So I want you to push into my hand, and then we're gonna hold it there. Our goal is 30 seconds, okay? So go ahead and hold it, and I want you to breathe, okay? We're breathing through it. All right, you're doing great. All right, awesome. Keep pushing, hold it. All right, go ahead and relax. Good, so that was 30 seconds. You held it, you did great, so that's awesome. So now we can move on to our next exercise, which will be a knee to chest. So we're just gonna we'll start with our right, and we're just gonna bring that right knee up into the chest, and we're gonna hold it there. So go ahead and grab the right knee. Good, pull it into your chest. As far as we can go, that's comfortable. And we're just gonna hold it there for 30 seconds. Good. All right, you're doing great. Your range of motion looks good. This is just to kind of further increase that flexion motion that we have. And again, with the segmental mobility, kind of getting that those vertebrae moving in that flex position. Okay, so that was 30 seconds, so you can go ahead and relax. All right, any increased pain with either one of those things we've done so far?
No, I think it's feeling a little bit better.
It's feeling a little better. Okay, that's great. So your range looks good, and you're not feeling any pain. So we're gonna move on to our next one, which is double knee to chest. So we're gonna bring both knees to our chest at the same time. So go ahead and bring both knees. You can grab them with your hands and bring those knees to the chest. Good. Awesome. We're gonna hold for 30 seconds again, and keep breathing with me. Doing great. Good. There we go, good, 30 seconds. All right, 30 seconds is up, so go ahead and bring them back down. Perfect. How's the pain feeling? Any pain?
It's actually feeling a little bit better.
Feeling a little bit better. All right, so we're on the right track with our exercises, so that's good. You breezed through those first couple, so I'm really impressed. I know you already started working on them a little bit last week with the PT. So this is kind of a little warm up, little review for you. So now what I want to do is move into some abdominal strengthening, okay? So we're going to really be working on our rectus abdominis, that big muscle in the front, and our obliques bilaterally, okay? So the first one we're going to do, we're going to start with our hands on the side. So one hand on each side of you, good. And then all we're going to do is just bring that head and shoulders up off of the ground into a little crunch motion. You should feel a little tightness in the core there. So go ahead and come up. Good, just up, yep, just get those shoulder blades off. Good, come up. Good. And we're gonna do 2 sets of 10 since we're strengthening here. Good. Good. Fantastic. Good, give me 2 more. Good, last one. Good, relax. Okay, so we did 2 sets of 10 and your form looked great. You feeling okay?
Mm-hmm.
Okay, so now we're gonna try and move on to our next progression, which would be hands across the chest. So let's go ahead and bring them across, and then I'll have you come up in the same thing, just come up in that crunch. Good, a little bit harder, huh? You're doing good. Nice, all right, okay, all right, let's stop. All right, your form looked a little shaky there, so I'm gonna say we're gonna hold off on that one until we get a little bit more strength in the rectus and the obliques, and we'll just regress back to hands at the side until we get a little more strength, and then we'll move on to this. Eventually we'll get those hands behind the head, and then after that we'll be working on each oblique unilaterally, so we'll go across the kind of shoulder to knee, if that makes sense. But for now, we'll stick with this because it seems to be a challenge. Great, so how are we feeling?
I'm feeling good.
Okay, great. So let's go back up and sit up for me. Good, great. And we'll just sit up. Great, and you did awesome today. How would you rate your pain now that we finished with everything on a 0 to 10 scale?
I'm definitely feeling better. I'd say about a 5.
A 5, okay. So the pain is lessened a little bit, so we're on the right track. That pain down your leg hasn't moved to the toes, is it?
Mm-mm.
Not near the toes? Okay, so it's stayed where it's at.
Yep.
It's great. Do you have any questions for me or concerns about anything we worked on today?
I do not.
Do not? Okay, well you did really good. We'll continue to work on the strengthening of the core, and we'll just progress through that and see how we do, and we'll get you set up for the next session with me. And it was really nice to meet you.
Nice to meet you too.
Thanks.